Hello everyone. I'm Dr. Richard Grant, and today I want to share with you a very important message. This information relates directly to our heart health, our brain, our memory, and even our longevity. Especially if you're over 50, this is a topic you absolutely cannot ignore. For many years, we've often heard that drinking a glass of red wine a day could be good for the heart. Or that men could drink a little more than women. But let me be clear, that was the old advice. And now, health experts have officially issued new guidelines. There is no amount of alcohol that is truly safe for our heart and brain. And this is a major shift. Because in the past, the guidelines said men could drink up to 2 drinks per day. Women could drink 1 drink per day. But now, scientists are telling us, even a small glass can be harmful. Why this sudden change? And what does it mean for us, especially those of us who have entered middle age and beyond? In today's video, we're going to dive into the latest evidence on alcohol and blood pressure. How alcohol affects the brain, memory, and dementia risk. Alcohol and pregnancy. Why even a little is dangerous. The real consequences if we continue our drinking habits. And finally, I'll share practical, easy steps you can take to cut back on alcohol and replace it with healthier habits. Why have the guidelines changed? For decades, many studies suggested that a little alcohol, especially red wine, could be good for the heart. This was called the French paradox, because in France, despite a diet high in cheese and red meat, the rate of heart disease was lower. And people thought red wine was the secret. But as larger, longer, and more rigorous studies have been conducted, the story has changed. Scientists discovered people who drink alcohol, whether small or large amounts, face higher risks of high blood pressure, heart disease, stroke, and even cancer. There is no solid evidence that alcohol truly protects the heart. In fact, the harm far outweighs any supposed benefit. Alcohol also raises cholesterol, causes inflammation in blood vessels, and disrupts heart rhythm. That's why global heart and health associations have updated their guidelines. We should not consider alcohol safe, even in small amounts. Alcohol and blood pressure. Now let's talk about blood pressure. High blood pressure has often been called the silent killer. It doesn't cause pain right away. It doesn't knock us down suddenly. But it quietly damages the heart, kidneys, and brain every single day. And alcohol is one of the key factors that pushes blood pressure higher over time. Even regular light drinking can raise blood pressure by 5 to 10 millimeters of mercury. That number may sound small, but it's enough to push someone from pre-hypertension into true high blood pressure. Alcohol also weakens the effect of blood pressure medication. That means, if you're taking medication, alcohol can make it less effective, making your blood pressure harder to control. And alcohol can trigger abnormal heart rhythms, especially atrial fibrillation, which raises stroke risk by 5 times. To make it simple, that harmless glass of wine or beer may be quietly setting you up for heart attack, stroke, or kidney damage. Alcohol and the brain, dementia risk. One of the most alarming discoveries in recent years, alcohol increases the risk of dementia and Alzheimer's disease. Our brain is like a finely tuned machine. When alcohol enters, it directly harms nerve cells, damaging the cortex and hippocampus, the areas responsible for memory. Even light or moderate drinkers experience faster brain shrinkage compared to non-drinkers. Studies show, drinking just 1 alcoholic drink a day increases the risk of memory decline after age 60. Alcohol also disrupts deep sleep, the phase when the brain clears out toxins. Without that cleanup process, harmful proteins accumulate, eventually leading to Alzheimer's. Imagine this: after 60, instead of enjoying life with a sharp mind, you gradually lose memory, unable to recall even your children's or grandchildren's names. And one major culprit? Those harmless drinks we thought were safe. Alcohol and pregnancy. Now, this may not apply directly to many of you watching, since most are beyond childbearing age, but it's very important for you to share with your children and grandchildren. During pregnancy, there is no safe amount of alcohol. Even a small glass can harm the baby. The consequences include fetal alcohol syndrome, growth delays, facial deformities, and poor intellectual development. Increased risk of miscarriage, premature birth, and low birth weight. That's why the new guidelines strongly emphasize, women should avoid alcohol completely during pregnancy. The consequences of continued drinking. To illustrate this more clearly, let me share a few real cases from my clinic. A 62-year-old man, healthy most of his life, had the habit of drinking one beer every night to relax. After 10 years, he developed high blood pressure, high cholesterol, and early memory loss. His brain scan showed signs of premature shrinkage. He was shocked, because he thought just one beer can't hurt. Another case, a 55-year-old woman, who believed that one glass of red wine daily was good for her heart. But she developed atrial fibrillation and had to be hospitalized after a sudden, severe episode of palpitations. When we analyzed her case, alcohol turned out to be a major contributor. These are not rare cases. They're happening everywhere. And they show us clearly, we cannot treat alcohol as safe anymore. Solutions: how to cut back on alcohol. I know it's not easy to give up alcohol. For many people, it's part of social gatherings, meals, or even a nightly ritual to sleep better. But here are some practical steps you can take. Cut down gradually instead of quitting suddenly. For example, if you drink daily, try reducing to 2 to 3 times a week. Replace alcohol with healthier choices, water, herbal tea, or low-sugar juices. Exercise lightly in the evening. A 20-minute walk will help you sleep better than alcohol ever could. Find new joys outside of alcohol: reading, listening to music, playing games with friends. Get family support. Tell your loved ones you're trying to cut back, so they can encourage you instead of tempting you. Conclusion. Dear friends, alcohol has never been medicine. And now, with clear scientific evidence, we can say for sure, there is no safe level of drinking for the heart and brain. High blood pressure, dementia, stroke, cancer, all are closely linked to alcohol. After age 50, our goal should be to live more slowly, more healthily, and to enjoy life with our families. Don't let alcohol steal your health, your memory, and your happiness. If you're drinking now, start cutting back today. It's never too late. Thank you for listening. If you found this message helpful, please share it with your friends and family, so together, we can protect our hearts and keep our minds sharp.